It's absolutely recommended that mothers who give birth to babies and are taking seizure medications should consider breastfeeding. The dominant recommendation in this field is go ahead and breastfeed the baby because there is no significant, or actually there is no known harm to that. And in fact, there are studies that show that your baby will be in a better shape with breastfeeding while you are taking the medication in terms of their IQ. There was a study that looked at these babies when they followed them until they were 6 years old. Their IQ, their intelligence was even a little higher than those who were not breastfed. The other advantage for mothers is they will form a bond with the baby, and it's also important for the baby because psychologically, apparently, it has a positive effect when you breastfeed your baby, and later their chances of having symptoms of autism. It's not exactly autism, but the term is used in that sense, meaning being autistic-like. That risk would be less. So there is really no evidence to say that you or your baby would benefit from not breastfeeding. So the recommendation I emphasize is to go ahead and start breastfeeding and continue at least for 6 months. What medication is safe for you while you're breastfeeding goes back to the issue of what you are taking during pregnancy. And obviously you and your doctor have decided about the safest plan which has worked for you, and naturally you would continue that medication. Those medications are usually the ones that we have studied, and we have more information in the medical field about them. Medications like levetiracetam, its brand name is Keppra, or lamotrigine, its brand name is Lamictal, are more often used, or a few other medications that we have more experience with them. There is no evidence to say that they would harm your baby, and you have to continue also with another fact in mind, that your own seizure control is critical because you are taking care of the baby. So you don't need to worry, lower the dose, or sometimes there are patients who may stop the medications because they think they are harming their baby. That's not true at all. In fact, it's harmful. You are doing yourself a favor by controlling your seizures, and by breastfeeding the baby, you're increasing their chances of better health, including those that I mentioned, intelligence in the future, and less risk of autism. You should not stop your medication before you start breastfeeding at all. It's quite safe to continue taking your medication because your medication would be excreted in the milk. Baby will get a small amount of it, but keep in mind, baby in the womb was exposed to the medication. After birth, they get a smaller amount in milk, in breast milk. So you don't need to worry about that. But of course, you have to look for any signs in case the baby is too sleepy or anything unusual, and check with your doctor because they may need to adjust your dose. But you do not stop taking your medication. It's only harmful. Yes, there are ways that can help while a mother is breastfeeding the baby while they're taking anti-epileptic drugs. Again, it's quite safe, and it's recommended to continue breastfeeding while taking the medication, at least for 6 months. But those few methods that we can combine with this is using occasional formula. The other method that can be used is to take seizure medication after breastfeeding the baby. That way the amount of medication in the breast milk would be less. Combining these would be quite helpful. Also, those mothers who know their baby's habit, for example, if the baby goes to bed at 10 and wakes up in the morning, it's reasonable to breastfeed them before that, or alternatively use the formula so the mother can get several hours of sleep as well, which lowers the risk of seizure. And of course, they need to be more vigilant and ready to take care of the baby next day. And then during the day, they can resume the breastfeeding.